Family medicine physicians provide comprehensive health care for the whole family, both children and adults. On this week's Health Talk, a family medicine doc who recently joined Norwalk Hospital and New Vance Health will join me to discuss his specialty and why it's so important. Hi, I'm Dr. Eric Mazur. Today on Health Talk, we're going to discuss the important and rapidly expanding specialty of family medicine. Joining me is Dr. Jatin Rana. He's a family medicine physician with New Vance Health. Jatin, welcome to Health Talk.
Hey, thank you.
And welcome to Norwalk. Welcome to New Vance Health. It's good to have you here.
I'm happy to be here.
And I understand you're here to be closer to family. No better reason to be here.
That's right, that's right.
So, Jatin, you're a family medicine physician. I think people out there tend to think of GPs and family medicine docs and even general internal medicine docs all in the same breath, and they're different.
Yes.
And maybe you could tell us a little bit about what is family medicine and how does that differ from the GP and the internal medicine doc?
Sure, I can. So basically, family medicine is a specialty, in primary care, where we actually see all different types of patients of all different ages, okay? So we see pediatric patients, children, we see adults, we also see geriatric patients. And we also take care of many problems, many chronic problems, many acute problems. Many times, when you go to a specialist, let's say a GI physician, a gastroenterologist, or a hematologist, they focus on one organ. They're specialists in that area, but we see all different types of chronic problems, hypertension, COPD, which is a lung disease, we also see diabetes. Everybody's familiar with diabetes, high sugar. We not only take care of those chronic medical problems, but we also help with acute problems. So if let's just say if you're a mother of a child and you have an acute issue, you want to come and see us for, let's say, a cough, and your son needs a sports physical. Well, you can come to the same office, schedule 2 appointments, separate appointments, obviously, and we can see both of you, as opposed to you coming to me and then taking your son to a pediatrician who is also in primary care.
I think that's really important. Family medicine grew up after I finished my training, but it was really in response to the need for people who would really focus on primary care for the whole family. But you said something there that I think is really important. You're a specialist. GP is an old term. I think we're seeing it used less and less, general practitioner. But the general practitioners generally were not trained beyond an intern level, 1 year after they graduated medical school. So they were never specialists in anything.
Yes.
Whereas in family medicine, you trained for what, 3 years, 4 years?
3 years, yes, 3 years. Basically 3 years of residency. And during that time, we actually were trained in different various areas with family medicine. One of them being OB, which is not something we practice nowadays, but we do have training in that. But one of the benefits is that we also do women's health.
You do pap smears and mammograms?
There you go. And so that's part of preventative medicine. Doing pap smears, detecting cervical cancer ahead of time. Mm-hmm. Family medicine, we want to prevent diseases from happening. And that's why we want patients to come in, maybe get their annual visits with us. We do women's health. We have you set up during your annual visit. Even for men, we do rectal exams, to check the prostate. We do comprehensive medical exam, from head to toe, and we also do blood tests, which, we have our labs here with Quest Labs, Norwalk Hospital, Sunrise, and we're located over here at Norwalk Primary Care West, which is just 3 minutes away from the hospital. So many times, if you were to make a visit with us, we would send you to our Norwalk Hospital to get the blood test. So we do a comprehensive blood test as well. And these blood tests, they include, I call it general health panel, but that's like a CMP, comprehensive metabolic panel. And that includes, checking your liver enzymes, checking your kidney enzymes, your electrolytes. It also checks your sugar. Now, these are all things that are very important to know when you come in for a physical exam, In addition to that, we also want to check your cholesterol levels. A lot of these things give us a preliminary idea of where you stand. And let's just say you do have an abnormal cholesterol, a lipid panel we call it, but to check your cholesterol. If you have something abnormal, we would treat it. to help prevent heart disease. And let's just say we detect some issues with your heart, we'll try to manage it, but if we cannot, then we go to our counterparts, our friends, our specialists, the cardiologists. So we're not afraid to, give referrals out to the specialists when it comes time. When we're not able to manage, we can co-manage with the specialist. So that's another relationship that we have. So when you come to us, we have those resources.
You used an important word there, co-manage, because I think one thing that happens to patients who are seeking just specialty care is they sort of get lost in the specialty morass and nobody's coordinating it and putting it all together. Yeah. And one of the, I think, important functions of a primary care physician and for an adult and general internal medicine physician is that you can coordinate these things. You can put things in perspective. You can balance treatment for one thing versus something else that you may know is going on. And so that coordination of care, I think, is very important.
It's very important. It's very because a lot of times what happens is that, as a family medicine doctor, I want to know about my patient. And if I'm sending a patient to a specialist, I want to know what they did, what new medicines they put them on. And that's another thing that we go over during your med check visits with family medicine, is going over your medication. That's very important because it tells us a lot about your chronic problems. And if you were seeing, let's say, a cardiologist and they put you on a new hypertension or high blood pressure medication, we would like to know that, just to make sure that you get the best care.
That's right. And the cardiologist may not know that you're also on a medicine for depression that may not work with your antihypertensive medicine.
That's right.
So these are important things, I think, to have somebody to coordinate the care that you can trust.
That's right.
And I think sometimes too, as a specialist, I am a specialist, I'm a hematologist, but I've always loved general medicine. But I think you can see things fairly narrowly in terms of your own specialty.
Yes.
And it's important to have somebody to tug you back to reality and say, no, wait a second, don't worry about that, because in the context of everything, that slight anemia really isn't important, if you will,
yes.
or something like that. Do you just want to say something about internal medicine? Because general internal medicine and family medicine, I think particularly around here, are similar, but they're not the same.
Yes.
So general internal medicine, how do you differ from a general internist?
So, I get that question a lot too. So with family medicine, what happens is, once again, we take care of the whole family because we're taking care of patients of different ages. One of the, and internal medicine, basically they're taking care of patients 18 and above, so adult patients. Now, in terms of family medicine, what I appreciate is that when you're taking care of patients that are all related in the same family, you learn a lot. So let's just say a patient, a 40-year-old woman is coming to you for taking care of her medical problems, whatever they may be, and you also see their mother who has diabetes, uncontrolled diabetes that led them to dialysis. When I see the patient, the woman that's 40 years old, we can kind of plan for these types of things. Hey, listen, you have diabetes that runs in your family. We need to get that under control. We don't want to end up where you start developing worsening problems with diabetes. And and I know a lot of people already know, diabetes can lead to other problems such as kidney issues. It could lead to neuropathy. It could lead to blindness. And so we want to prepare for this. Once again, I want to mention that family medicine, we're all about I'm a big fan of preventative medicine, and we want to prevent you from having a problem. And the way to do that is at least, make an appointment with us and get the annual check. That's how we're going to know. And so that's how we differ from internal medicine, is that we like to see the whole family, and that's just a benefit for the patient.
As you said, you take care of the kids too.
Kids as well.
So you can give immunizations to the kids.
Yes, we do. We know immunization is a big thing for the pediatric population. Many things also, sports physicals, are very common for the pediatric population. And so yes, we take care of pediatrics all the way up. We start up at newborn. Okay. So, even to get those immunizations, starting at newborn, you got to make your 2-month follow-up, your 4-month follow-up, 6-month follow-up. We take care of all that stuff. So.
Now, let me say that people at home, and I think this is worth a couple of minutes, used to think of, I'm going to date myself, Marcus Welby, or one of the doctor who sees them in the outpatient setting, meets them in the emergency room when they're having
yes.
a problem, takes care of them on the inpatient service, really is there morning to night, I think that was in the days when medicine was much less complicated than it is today. Do you want to say a few words? Because now I think hospital medicine has pretty much taken over on the inpatient side. I personally believe it's a very good change because you have experts in inpatient medicine managing you, but you must get questions about that all the time. People still sort of wonder about their physician following them in all these venues. And I think that, as I said, my personal feeling is that medicine's gotten too complicated to really do that, and that you're an outpatient specialist.
That's right. Now you know what? I do enjoy my outpatient specialty, but when I did train in family medicine, that was 10 years ago. Even during training, we used to do exactly what you described. You know, we would see the patient as in an outpatient setting, and then we would follow. If they were getting sick and were admitted, we would see them. We would make rounds in the inpatient setting, and this has changed. You know, and even when I was training, I would get information. Or when I started my practice, which was 7 years ago, I would hear from patients, "Hey, are you not going to follow me at the hospital? Are you not going to see me?" But, you know, I do give them reassurance, okay? Because one of the systems that now this is a huge hospital system. We do have hospitalists that specialize in hospital medicine and that see the patient in when you go to the hospital, you go to the emergency room. And then,
by the way, where there were now specialists in emergency
medicine, that's right. And then they decide whether or not this is acute, they treat it, or they say, hey, this is chronic and we need more attention, we need to hospitalize you, admit you. Then the hospitalist, who is an internal, or whatever hospitalist, internal medicine, they admit the patient, they manage them. Now, one of the key things about this relationship is the communication.
Exactly.
That's important, okay? So I want to assure our patients that there's clear communication when a patient is being admitted to the hospital and being managed for, let's say, 5 days, 6 days, 7 days. The hospitalist, at the end, when they discharge you, they do write a thorough discharge note that they send to us, and that's very important to me because I want to know what happened. I want to know what they did, what they treated you with, what medicines they gave you, which specialists saw you. And then with all that information, we also advise, even they advise you to follow with your doctor. Yeah. And that's called a transitional care management visit. So after your discharge, you make a hospital visit with us, and we go over all this. And to be honest with you, a lot of patients, when they're in the hospital, they're sick. So when they're discharged, when they're getting better, they just want to go home. Right. They don't ask the questions. They don't want to even know about it. They just want to say, when am I going to go home? So but that's why you need to make a hospital visit with us, because now after 2 weeks, you've gotten your comfort level. You come to us, you ask us whatever questions you want, and I'll go over everything with you. If we need to put you on additional medication, we will. And if we need you to follow with your specialist, we will set that up for you. So there is clear communication, and I want to assure patients that, And
I think you said a very important word there. You talked about systems of care, and healthcare really has changed from 40 years ago, where it was often one doctor, one patient, and we didn't have a lot that we could do because we didn't have a lot of medications or interventions. Today, where we have so many things that we can do, we have much more highly specialized, but the key is integrating that. And communicating across those boundaries. And that's again, you're sort of the focus of that. You're the center, and the spokes go out, the specialist, the hospitalist, but you're the center of that wheel, and patients need to recognize that. It's a wonderful specialty. It's one way to get your primary care. I want to thank you for coming on the show. We've run out of time, if you can believe it. And I want to thank my guest, Dr. Jatin Rana, for joining me on Health Talk today. And thank you for watching. Remember, you should have a primary care physician. Please share your questions and comments with us by contacting us at healthtalk@nuvancehealth.org.
Our fight against coronavirus isn't over. We still have to slow the spread and do our part. Let's wear face masks in public. Stay 6 feet or more from others. Follow state and local guidelines. Wash our hands frequently and stay home when we feel safe. For ourselves, for our loved ones, for our future. Let's move forward together. Learn more at coronavirus.gov.
Your blood pressure numbers could change your life.
A lot of people don't understand, including myself. I didn't, now I do, the impact of having a stroke.
My memory is shot.
When I woke up, I couldn't speak.
If I would have followed a treatment plan, I would not be in this situation.
It's a tough journey.
Lowering your high blood pressure could save you from a heart attack or stroke. If you've stopped your treatment plan, restart it or talk to your doctor about creating one that works better for you. Start taking the right steps at manageyourbp.org.
It's a new life, but I'm gonna make it better. I'm coming back. Ask your doctor, check your blood pressure.
A little preparation can go a long way when you're planning to see your primary care physician. Be strategic and plan to focus on your most important health issues. Also, things as simple as a list of your current medications and writing down your questions ahead of time will make your visit much more efficient, productive, and personally satisfying. Hi, I'm Dr. Eric Mazer. Today on Health Talk, we're going to discuss what you can do to have a successful visit with your primary care doctor. Joining me again is Dr. Jatin Rana. He's a family medicine physician with Nuvance Health, actually a relatively new member of our family here. So Jatin, you're a family medicine physician. I'm sure you, like I, have had vast experience with different kinds of patients. What makes a successful, what can a patient do to make a successful visit with you?
You know what? That's a great question. I want to start off from the beginning. Let's just say when the patient is scheduled for a visit, you know your time is, let's say, at 9 a.m. It's always important to come 15 minutes ahead of time. And I'll tell you why. Because in that 15 minutes ahead before your visit, you know, they do something called, you want to check in at the main desk. You know, they check your insurance, they check your name and information. And then once that's all done, what happens is a nurse gets communication from the front desk and says that patient is ready to be checked in. What they do is something called triage. And triage is basically, they check your blood pressure, they check your vitals, including blood pressure, pulse, they get your history. They prepare you for when I come in and see you. So that's very important. You know, I think that's in the beginning. And then, and like you were saying earlier, is that preparing for the visit. You know, one of the things that I do when I see a patient for the first time is that you obviously want to, we review the chart ahead of time. I review the chart ahead of time to kind of get to know the patient. But many times that chart is not updated. So when I see you first, I want to review your medications. Okay, your medications tell us a lot about your history, your medical history. What medicines you on? Tell me, if you're on a cholesterol medicine, let's say lovastatin, it tells me you have high cholesterol. If you're on metformin, which is a diabetes medication, tell me you're on diabetes. So this is the way I know I can also figure out what chronic medical problems you have.
And when I may say, it doesn't help to say a blue pill.
Yes.
We don't want patients to bring the names and the dosage, and ideally even the bottles if they can.
You're exactly right. You know, and the thing is that, you know, medicine is not your specialty as a patient. It's my specialty. So I don't expect you to know all the names. And I understand, like if I go to a sandwich shop, I mean, I don't know the name of some specialty sauce. I mean, I just want that white sauce. I understand that. But if you could help me out by bringing your medicine bottles, and I can read it myself, or my nurse can read them themselves when they're doing the triage, then that will help us out. You know, one time, well, many times. Well, let me stop there. Actually, when I was training, my attending, who was my professor, he told me that when he started his practice, which was 30 years ago, he offered every patient a plastic bag to bring with them during every visit. In that bag was just supposed to be just for his or her medicine. And that way, that bag was something special, you know, meant something to the patient. And whenever they came to the office, they had to bring that bag with them and it had to be with their medicine. But now things have changed. You know, I understand carrying a bag of medicines can be maybe somewhat inconvenient, but now we have smartphones, you know, or you could write the list of your medicines on a piece of paper. And if you bring that, that's so handy, and that helps us out a lot.
Because a lot of people will say, well, can't you check the record? Can't you check with my pharmacist? But things change.
Yes.
You know, there may be a medicine you started that you stopped. Sometimes people have left over something that they start taking again.
Yes.
And we need to know what you're taking. Right, and we should mention also supplements and over-the-counter
Medicines as well, yes, because
those are real medicines.
Those
are
are real-
things we really want to know about.
yes, I mean, I could tell you an example. Like, sometimes patients say, "Oh, I've been having this ache in my knee, and I'm taking ibuprofen. I'm taking it 4 times a day, and that can do some harm to you if you're taking it for a long period of time. It can cause you GI bleed, it can cause you kidney issues, and then when you come in and I put you on another medicine that can do the same. In my thought, I'm helping you because I want to help your pain out or whatnot. But if you don't tell me that you're on these over-the-counter medications can have drug-drug interaction, and that can cause more problems. And we don't want. That's the least thing we want to do. That's the last thing we want to do, actually.
And supplements have real effects too. Just because they're natural doesn't mean that they don't have real effects.
Yes.
Vitamin D, you can make yourself sick from too much vitamin D.
Oh, yes.
While it's necessary vitamin, you can take too much of it.
yeah.
You can take too much calcium. You can take too much iron. There are ways you can make yourself
Too much
sick.
of everything is bad for you, But no, definitely that's true.
And let me talk a little bit about patients identify if they have things they want to talk to you about.
Yes.
How do you suggest they deal with those issues? I sometimes feel like patients will come in with a list of 20 or 30 things to discuss, which may not be doable, which isn't doable
it's
in a visit.
Especially when you're
but
limited.
How should you tell them to manage that?
You know what? Many times patients they come in. They like to make their list of whatever issues they're having, and then they like to clump them all and then make a visit. What I would say is that we should make small visits, multiple visits at a time for individual problems. So in that list, if you do have a list of 10 medical problems, I would say let's concentrate on maybe the top 2 or 3 problems, because once again, we're on limited time and we want to give you the best care possible for those 2 to 3 problems, because we want to evaluate you, we want to get your proper history, we want to find out those whatever you've tried at home to help as ailment for that medical problem, and then we want to focus on those things. And then after that, like I said before, we should, what I would say is, okay, the next 3 problems, maybe make another visit, a short visit. It doesn't have to be a month out, and that's a fear for patients too. They say, hey, but I'm not going to see you again until 3 months. But we will take care of that.
Yeah, and I think for those top 1 or 2 things, the things that you're most worried about.
Yes.
I mean, we've all had experience where someone will come in and talk about a rash, and then as you're walking out the door, oh, by the way, I've had chest pain when I begin to walk up a hill. Well, that's much more urgent than a rash.
No.
And we want to hear about the chest pain first, not as we're walking out the door.
That's right. No.
So I said during the teeth, I said, be strategic. I think the patient has to be strategic and decide what are the things that I want to deal with my
Yes.
primary care physician, because I can't deal with every little thing, or that I want to get my bunion fixed at the same time that I'm having palpitations. I want
Yes.
to deal with the palpitations as the urgent issue.
Definitely, that's going to do more harm. We definitely want to prioritize and concentrate on that medical problem that's going to probably exacerbate, do more harm to you than something that we can handle later, like a rash.
And other things that a patient should do before they come to the visit or think about?
So we talked about medicine. We talked about preparing before before coming in early for the appointment. Making a list, very important.
How about bringing somebody with them? How often do you suggest that for your patients? Because there have been a whole bunch of studies that we could talk to patients and they'll remember 30% of what we say
Yes.
the moment they step out of the office. So how do you enhance their take home?
Yes, with that situation, it is always nice to bring someone with you if you can, especially if you're elderly and you have issues with memory, or if you just need some other support system, because many times you're already nervous about your chronic medical problems. Having someone else there is taking notes for you is very helpful. But we also provide you with an after-visit summary. Okay, and that summary is basically, a list of your medications, what we discussed. In my situation, whenever I see a patient, I go through what I need to go through as far as finding out what's your problem, what we're going to do as far as lab tests, and then we come up with an assessment and plan. And then at the end, I always go over that assessment and plan at the end as like a kind of final summary, just to reiterate. Obviously, if we're asking you, hey, do you have any questions? We do want you to ask questions, yes, because we want to clarify it at that time. We don't want you to go home and say, oh, I forgot.
I was going to ask you about that. What do you do? What should the patient do when they go home and they say, oh my God, I forgot to ask Dr. Rana this? Do you like to email you? Should they call you? What's the best way for them to get that last minute question or that late question answered?
Sure. With the Nuance Health, we have this something called the portal. If you're a member of our healthcare system, you get access to the portal, and that's the best way to communicate.
So the ways to ask their doctor
questions. It's just almost like an email, a personal email for your health information, and it's private, it's protected, and we get that message right away, and we can answer directly to you, or we can even call you if we need to let you know. That would be the best. You could always call our office as well, but the portal system works really well.
Great, I didn't even thought of it. And just so as I'm sitting here, I'm thinking about new technologies. They're not even that new. Do you ever have a patient record your visit? No? And how do you feel about that?
As far as recording goes, I'm not too comfortable with that, but I've had patients that sometimes say, hey, can I record a procedure? And as long as I'm not in it, I'm like, okay, you can see this, but for the most part, I'm not too comfortable with that as far as technology goes. But as far as taking pictures, if I need to, let's say for a rash, if a patient comes in for a rash, and I want to document a rash, because many times what happens, you see a rash, and then you give them treatment, and for you to know whether the treatment worked or not, you would want to document initially. And so that's very helpful. And I do share that with the patient, try to get their permission to make sure they're comfortable, because many times people are not comfortable, and that's fair.
That's actually an interesting point. Patients could do that too if they have a rash that's changing or a mole that's changing. To take a series of pictures and provide them to you can be very useful.
Oh, I love that. And you know what? That's another way of preparing for this visit. Many times, they would see, let's stick with the rash again, taking pictures. Pictures are great. Or let's just say, even this may sound a little gross. Nothing's gross for us. We're all physicians. I know patients always say, hey, I'm going to show you a picture, but it's going to be gross. I don't mind at all. We don't mind. We've seen it all. But, let's just say if you have rectal bleeding, they say, oh, I've had this much bleeding. Let me show you what happened. And they take a picture of the stool specimen, and we evaluate it. That's very helpful information, to be honest with you. So we like that, actually. We if you want to show us videos of a progression of your rash or pictures, we would really appreciate that. Like they say, a picture is worth 1,000 words. So it's really helpful.
I remember a time where my son was in Tennessee, and I was up here, and he thought he had poison ivy, and he was scratching, and he sent me a picture, and it was actually herpes zoster. And we ended up
totally different treatment, right?
Totally different treatment, totally different implications.
Yeah.
He turned out to be fine, but that was early in the days of cell phones, and it was just so incredibly helpful.
Yeah.
And I could make the diagnosis actually easily by telephone.
Sure. And technology is advancing, and medicine is advancing, and this is great for overall healthcare as well.
So writing things down, I think coming with a pad and paper is a great idea. That
yes.
Not only do you come in with your questions, but then as you get your answers, write them down. Doctors' visits, I think even for a physician, they're tense. They're a little bit disorienting.
Yes.
If you're getting serious news, it's even more disorienting.
Yes.
The more you can write down, the better.
The better. And that retains information. There's so much you could remember, especially with all the stressors going on. If you could, and that we like to provide like an after-visit summary. I like to go over things at the end of the visit, which is really helpful. I find that very helpful to summarize everything at the end of the visit for patients.
We have just a few seconds left. Do you want to say a couple of words about the internet and Googling your illnesses?
You know what? Yeah, as far as Googling, and patients love to Google about their medical concerns. To be honest with you, I would not advise that. Just because you would find the scariest things. If you see a small mass on your knee, and you Google that, the first thing that's going to come up is cancer, and that's going to freak you out. That's going to cause you to be more stressed out. The best thing would be if you have a primary care doctor, try to make a visit. Nowadays, you can make telehealth visits. Yeah. So that's convenient.
And just because it's written down on the internet, it does not mean that it's true. There's a lot of garbage there. There's actually a lot of good information.
Exactly.
But I think it's hard to sort through those because they can both look pretty.
Yes.
And unfortunately, we're out of time. That should be a whole other show, the internet and medicine.
Yes.
We should do that. So unfortunately, we are out of time. I really want to thank my guest today, Dr. Jatin Rana, for joining me on Health Talk, and thank you for watching. Please share your questions and comments with us by contacting us at healthtalk@newvancehealth.org. And remember, get a primary care doc.